Hello, this is Dr. Gretchen Kubacki, and I am a health psychologist and certified bereavement facilitator in West Los Angeles, California. And today I wanted to talk to you about what happens in a therapy session. I know it's kind of daunting to think about going to therapy. Um, Therapists are head shrinkers and they get inside your mind and they know what you're thinking and they tell you what to think. Wrong. All of that is wrong. Um, that's totally not what we do at all. Well, let me tell you what we do. I am a psychologist, so I will get some information from you. I will tell you about your rights and your obligations as one of my patients or clients, as we call you. And I will explain how the process works. And what I'll tell you is that basically we're going to meet once a week for 50 minutes and we're going to sit and talk. And depending upon what it is that you need help with, we will have a pretty engaged discussion. You're probably going to talk more than I'll talk, but sometimes I'll talk a little bit more than you do. It depends, and I'll have a lot of questions for you up front so that I can know you and understand your problem as well as possible and come up with some things that I think are going to be helpful for getting you through the problem that you're dealing with. So, to that end, I have a whole bunch of forms. Some of them are legally required, some of them are ethically required, and some of them are just useful for me to kind of cut to the chase and get some information down in black and white that I can quickly scan and assess and know what other questions I want to ask you in a bigger way. Things kind of highlights of your life and some of the goals that you have for therapy. Goals, you may say? Goals in therapy? Isn't therapy some sort of open-ended process where we just sit and talk forever and I lay on a couch? Well, no. Usually we're face to face. You're sitting upright in a chair or on the couch. Sometimes people do choose to lay down on the couch, and that's okay too. Um, but it's not intended as a never-ending process. My ultimate goal is actually to make myself expendable. I want to teach you and model for you how to make good decisions and how to handle your feelings and how to be healthy and happy in relationships. So I will use different techniques and sometimes assign you some homework and ask you to work on things while we are between sessions, because therapy doesn't just take place in the 50 minutes in my office. It takes place all the time. When you leave, you should be thinking about things that we talked about and how you want to change and what it's going to take for you to be able to change, and then to bring that information back into the next session that we have, and we'll talk about that and we'll go from there. So in a session, we'll always remain present focused, but we will definitely delve into your past. It is really important to know what happened to you in terms of how you were raised, how your parents treated you, what your siblings did to you, or how it was to not have siblings or to be adopted, for example. I want to know about the traumas that you've experienced in your life, the losses, and the things that you're most proud of, and what you want to accomplish in your life, and what is standing in your way. So the stuff that we're going to work on is what's standing in your way. And when it's emotional, that is where the benefit of therapy comes in. So I'm sure that this video has raised a few more questions, but I hope it makes you more comfortable with the idea of therapy. I'm really happy to talk to you about it, answer any more questions that you may have. So feel free to give me a call at 310-625-6083. You can even text me on that number. And check out my website at drgretchenkubacki.com. It's Kubacky. It's been my pleasure to talk to you today and give you a little bit more information about what actually happens in therapy.